Hi, I'm Dr. Devayani Barve. I'm a plastic surgeon practicing in Mumbai. I get asked by patients often, what can be done for anti-aging? Now, this is a very general sort of a question, and it can come from 25-year-olds, 30-year-olds, or even 50-year-olds. Most of us fall into the category in which we don't want to do too much or too regularly, but we want to look nice. Well, that's obvious, right? So I'm going to break down what are the things you can do to look good, keep a tight budget, and making sure that you don't spend too much time and too much money on looking good. So the popular treatments which are available for anti-aging include neurotoxins, fillers or injectables, and various skin surfacing measures. So if you're worried about lines and wrinkles appearing, then Botox or Dysport or one of the other neurotoxins which are available is a good option for you. If you're not somebody who wants to do it regularly and just wants to get it done before an event or a function in the family, then that works too. You can get it done maybe once a year. Ideal recommendation is to do it every 5 to 6 months to prevent permanent lines from coming in. But it's also okay to do it once a year or once in a 15 to 18 months if you're on the younger side. Fillers or injectables can be expensive, and using 2, 3, 4 syringes at a time can be heavy on your budget. So you have to think about what areas bother you the most and start with those. So most common problem which I face when patients come to me is they will point out one area, but I know that to fix that area and make the patient look good, other areas have to be treated first. I'll explain. So if somebody is worried about these lines being very prominent, I can't just put filler here and expect them to improve. Just putting filler here without treating what is causing those lines will cause your area to look puffy and for you to develop that kind of a monkey face, with a puffed center of the mouth. For these lines to improve, this area has to be treated on, which will lift up the skin and cause these lines to become lesser. A lot of patients may not understand this concept, and so when we explain it to them that first you need to treat this, then we will treat this, the confusion comes in. They feel that the doctor has talked about some other area which is not even bothering me. So here is how planning which areas bother you, planning the budget for you, and planning which treatments to do first comes into picture. When we are talking about a certain area which needs not just filling but lifting, a lifting procedure may be better and more worth your money than a filling procedure. What I mean by that is to expand on the example I gave you. If these lines are bothering you, and if you are a candidate for a lift, then a thread lift or a tightening procedure which lifts up your cheek and makes these lines go away and gives you fullness up here will be a better procedure for you and a better use of your hard-earned money rather than putting fillers or injectables in the concerned area. So these are the nuances which come into play when you're talking about planning a treatment, looking at the whole face. You don't want to just tackle one particular area such as the jaw or only the eye without looking at the whole face in general. So when you go for a consultation, make sure that you discuss the whole face and make sure that you discuss what your budget is, how often do you want to keep spending whatever you're going to spend, and what are your requirements. Patients' expectations go a long way in managing how to most effectively give them the best skincare regime. A few things which I will never skimp on or never avoid while suggesting a skincare regime is a good face cleanser depending on the type of your skin, a good moisturizer again depending on the type of your skin, and definitely always a good sunscreen. Even if you keep a bottle or a tube of sunscreen in your bag and keep applying it a couple of times in a day, that itself will go a long way in avoiding sunspots, in avoiding fine lines and wrinkles, in avoiding little dots of pigmentation or freckles which come on fair skin. So this itself will go a long way in helping you in your skincare and reduce the amount of money otherwise you may need to spend on skin treatment. Anti-aging, of course, goes beyond non-surgical options into surgical options as you grow older. You may need a brow lift, you may need upper and lower lid surgeries, you may need a facelift or a neck lift, which last much longer and give you a better result, lasting almost for 10 to 15 years. But that is only and only when you require it. So make sure you plan your skincare just the way you plan your financial investments, and make sure that you're not overspending or spending on something which is not going to give you the best result. Thank you for watching.